Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now we are going to stress on the morphological changes. Morphological changes. And this is with respect to the acute MI. So first of all, let's look at what is reversible. Reversible, anything which can brought back. So this is up to 0 to 1.5 hours. So 0 to half hours is known as the reversible. So gross features is none, and let's divide it into electronic microscopy and the light microscopy. So only significant finding is in the electron microscopy. There is a relaxation of the myofibrils. So there is relaxation of myofibrils, and there is glycogen loss. So there's relaxation of myofibrils, there's glycogen loss, and there is mitochondrial swelling. So if this is a mitochondrial, there is mitochondrial swelling. So relaxation of myofibrils, there is a glycogen loss, there is a mitochondrial swelling, whereas there is no significant light microscopy findings and there is no significant gross features. Next, we move on to the irreversible injury. So till now we saw the reversible injury. Next is the irreversible. So under this irreversible injury, first is we go from half an hour to 4 hours. So from 0 to half an hour, we saw it was the reversible step. Now we move on to the irreversible step, that is half to 4 hours. So gross features is none, and when you look at the EM, that is electronic microscopy. Here there is the sarcolemma disruption is noticed. The mitochondrial amorphous densities are seen. So the sarcolemma disruption, and there is a mitochondrial amorphous deposits. Mitochondrial amorphous deposits. So this is under the electron microscopy. Next we look at the light microscopy. So under this light microscopy, it is usually none and variable waviness of the fibers at the bottom. So it is not much significant. Next is we move on to the 4 to 12 hours. So first was half an hour to 4 hours, and then we moved on to the 4 to 12 hours. So 4 to 12 hours, there is a dark mottling. There is known as a dark mottling. So this is the gross feature. Then we move on to the light microscopy, where it is significant, that is early coagulation necrosis, edema, and hemorrhage. This occurs from 4 to 12 hours. So there is early coagulation necrosis, early coagulation necrosis, and there is edema, as well as there can be hemorrhage. Next, we jump on to the 12 to 24 hours. So what happens in the later stage of the day? So 12 to 24 hours is also a stage where there is a dark mottling. So dark mottling is seen. This is in case of the gross features. So there is a presence of dark mottling which is seen. Then when you look on the light microscopy, what are the findings? So 12 to 24 hours is where upon light microscopy there is ongoing coagulation, there is ongoing coagulation necrosis. So at 4 to 12 hours we saw there was early coagulation necrosis. So here again there is ongoing coagulation necrosis. There is pycnosis of the nuclei. Next is there is myocyte hypereosinophilia. Hypereosinophilia. Next comes marginal contraction band necrosis. Marginal contraction band necrosis. as well as early neutrophil infiltrate. Early neutrophilic infiltrate. So all these are the features of 12 to 24 hours. Next we move on to the 1 to 3 days. So among 1 to 3 days there is mottling of the yellow tan infarct center. So there is mottling with yellow tan, mottling with yellow tan infarct center. And when you look at the light microscopy, there is coagulation necrosis with the loss of nuclei and striations. So there is coagulation necrosis. There is loss of nuclei and striations. Next, there is also the brisk interstitial infiltrate of neutrophils. So neutrophilic infiltration is seen. So this was about 1 to 3 days. So in 12 to 24 hours, there was early neutrophilic infiltrate. In 1 to 3 days, there is brisk interstitial infiltrate of the neutrophils, their coagulation necrosis, and the loss of the nuclei and striations. Now moving on to the 3 to 7 days. So later part of the week, 3 to 7 days, there's hyperemic border. So this is again the gross. There is hyperemic border and the central yellow tan softening. Hyperemic border and there is a yellow tan softening. So here there is a light microscopy. The light microscopy, it is the beginning disintegration of the dead myofibrils. So there is a beginning disintegration of dead myofibrils. So there is disintegration of the dead myofibrils. There is with the dying neutrophils. There is dying neutrophils. There is early phagocytosis of the dead cells. Early phagocytosis of the dead cells, and this is brought by the macrophages at the infarct border. By the macrophages at the infarct border. Next, we move on to the 7 to 10 days. So here in 7 to 10 days, that is beyond a week, in gross there is a maximally yellow tan. So maximum yellow tan is seen after a week. So max yellow tan. So maximum yellow tan and a soft with depressed red tan margins. And there is soft with depressed red tan margins. Red tan margins. Then upon the LM there is a light microscopy. There is well developed phagocytosis of the dead cells and there is granulation tissue at the margins. So well developed phagocytosis and this is of the dead cells. And next is the granulation tissue at margins. Next is granulation tissue. They are present at the margins. Next, let's go on to beyond 10 days what is happening. So after 10 days, that is 10 to 14 days range, upon the gross. So till now we saw there was yellow tan softening and then there's a maximal yellow tan and then softening with depressed red margins. This was 7 to 10 days. In 10 to 14 days, there is going to be the red gray depressed infarct borders. Going to be red gray depressed infarct borders. Depressed infarct borders. And here, upon the light microscopy, what do we have? So, light microscopy, there is a well established granulation tissue with the new blood vessels and the collagen deposition. So, well established granulation tissue. This is only after 10 to around the 10 to 14 days. So, well established granulation tissue. There is new blood vessels, BV, and also the collagen deposition is seen. Next, we move on to further months, that is calling it from 2 to 8 weeks. That is 2 weeks to the end of the second month. So, at this stage, there is a gray white scar. So, there is presence of gray white scar, and it is progressive from the border towards the core of the infarct. So, it moves from the border to the core of the infarct. Core of the infarct. Next, we jump on to the LM. So, what is LM? LM is the light microscopy. There is increased collagen deposition with decreased cellularity. So, as the month increases, there is increase in the collagen density or collagen deposition. So, increase in the collagen deposition, and there is a decrease in the cellularity. Then we move on to the greater than 2 months. So, in case of greater than 2 months, we have the scarring is complete. So, greater than 2 months is where we call the scarring to be complete. And upon the LM, there is a light microscopy. There is the dense collagen scars. So, there is the dense collagenous scars. So, they are noticed. So, this was about the MI and the morphological changes associated with it. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.